More Pennsylvanians have health insurance than ever before, but what does that mean for the healthcare workforce? I'm Jill Horner. This is Comcast Newsmakers. With me is Paula Bizard. She's Chief Strategy Officer for the Hospital and Health System Association of Pennsylvania. Thanks for being with us.
Thank you.
With more Pennsylvanians now having access to insurance, what kinds of pressures does this put on the healthcare profession overall?
Well, we already know we have a physician shortage in Pennsylvania, and so it puts pressure particularly in the area of primary care, which is important for your routine, ongoing, preventive vaccinations, maintenance. And so we have to look at some short-term and longer-term strategies to make sure that every Pennsylvania can get care at the right time, right setting.
And let's focus on what some of those strategies may include. One of the things that you say needs to be addressed is the credentialing process for a new doctor. So if someone does have their medical license, it doesn't necessarily mean that they can start to work with insurance companies right away.
Exactly. Each insurance company uses its own kind of forms and processes for credentialing the physician. We believe, and the Pennsylvania Medical Society believes, let's standardize the form, let's set a time frame of 30 days so that when we recruit physicians, we can get them practicing and the individuals they're caring for have the coverage that will pay for that care.
And so that's one of the things that you're calling for, and there is a piece of legislation that relates to that. That's House Bill 1663. But in addition to that, the credentialing and streamlining the credentialing process is one component. But what about the idea of actually having more practitioners overall?
Well, there's some short-term and some longer-term. We believe if you modernize the advanced practice nursing law, which would allow certified registered nurse practitioners to practice to their full licensed authority, these individuals can be used in areas where there is a primary care practitioner shortage.
Potentially rural areas, for example.
Exactly, or urban communities as well. And then in the longer term, we really have to be funding medical residencies for family practice, internal medicine, pediatrics, so that we have the physician supply that we need to serve all of the Commonwealth.
So you mentioned a few different things, and one is working to change or modernize the professional nursing law. What kinds of changes need to be made there, in your opinion, in order to allow advanced practitioner nurses to serve potentially more people?
Well, it's the ability under what circumstances could these individuals practice independently. Right now they have to have a written collaborative agreement, and they do practice very collaboratively in health centers, in hospital outpatient, in doctor's offices, but under certain circumstances we would like to see them be able to practice independently. And the nurse practitioners in the medical community are trying to work on what are those circumstances, and we are hopeful that they will work it out and legislation will pass.
But beyond that, though, you say there is an additional need for physicians, for doctors here in the Commonwealth, and there are shorter term and longer term solutions that you are working to address there.
Absolutely. I mean, the shorter term is those that we recruit, let's get them into practicing quicker. Longer term, we've got to look at the residency supply. Also, loan forgiveness. Medical school is very expensive, and so to increase the loan forgiveness for physicians who practice in shortage areas would be very helpful as well.
Thanks for being with us.
Thank you.
We've been talking with Paula Bizard. She's Chief Strategy Officer for the Hospital and Health System Association of Pennsylvania. I'm Jill Horner.